Hello, everyone. Hi, partner.
Hi, partner.
How are you?
Good.
So another show, Reflect and Reset with Maria and Gina. And we actually have a very interesting show today. We're going to talk about the stress of the children and the parents when they go back to school. But we're going to take it a little bit further than that, and we are going to have
Lissette Rodriguez, our psychotherapist, is going to join us on Facebook Live, and we're going to talk to her about what we can do and why kids suffer and how many kids are actually suffering from depression and anxiety. And I know it's a serious problem because I live with it with my daughter. She had anxiety from when she was a child, going to school, and to this day she still has panic attacks.
Right.
And I would love to get Lisette's idea on how to handle something like that.
We're going live on for May. We're going live on Gina's phone and my phone and our Facebook Live. So we are inviting Lissette, our psychotherapist, to join us and talk to us about how to deal with this. What are the choices that people have, especially these kids, the high school student? I mean, that is a very stressful age. And even college. I mean, I know when my kids went to college, for me, it was a traumatic experience. I remember how sad I was, how overwhelmed, I felt this overwhelmed emptiness. And do you recall that?
Yeah, sure. I mean, Erica's an only child. So when she went to school, she had major separation anxiety.
Yeah.
And I had separation anxiety because all I had was her.
Well, and that's the case. You know, the parents suffered from the...
And I think you portray it onto your children also, the nervousness of them leaving, and will they be okay, and will they do this, and you get nervous, and they get nervous about being away from home.
Yeah. I can tell you that for me, I remember when Franco, my older son, went away to college, and I was feeling almost like I lost part of me. Yeah. It was very strange. But I realized how close I was to this child, and for him to present, and that's the first time that you experience that. It's like, oh my God, they're grown up.
Yeah.
And
it's scary. It's scary for the parents.
Yeah.
Because you don't think they can do it without you.
Right.
And they actually do it without you. But then they do it without you. And then you realize, hey, you did a good job.
So I think we have Lissette. Lissette, how are you, my love?
Lissette.
I'm good. How are you?
We are doing well. We're very happy that you are joining us today to talk about such an important topic. I know that depression, anxiety, all of those mental health illnesses is something that affects many, many kids, and it affects the parents. And I know that you sent some statistics. I was talking to Gina before the show, and I said, wow, in that statistic, it says 1 out of every 5 kids are suffering. They're suffering from
some type of mental health.
So, welcome. Thank you so much.
So tell us a Tell us a little bit about these statistics and what's happening with these kids.
Okay, so I actually was researching some additional statistics, and I was looking at the National Institute on Drug and Alcohol Abuse, and unfortunately, drug and alcohol abuse go hand in hand with mental illness. So we're looking at approximately 62% of high school seniors that have tried alcohol. And then we have another 16% of high school seniors who binge drink. So they have 5 or more drinks in a row. And then we have a staggering 37% of high school seniors who've used marijuana, and 23% of 8th graders have tried alcohol. And part of the reason is because it is such a huge deal from a social, cultural, and all around to transition, the peer pressures, going into a new environment. That's usually the case for an adult. Imagine an adolescent who's still trying to understand everything that's going on in their world, and now they're transitioning into this world that is ever changing. So that's, go ahead.
Do you think it's a depression that causes it, or is it just strictly peer pressure?
So it's a combination of things, Gina. A lot of it has to do with the transition. Most people don't do well with change. Most people have a really difficult time. And then if you couple that with instability in the home or in their surroundings, then that just makes things worse. If there are low self-esteem issues, then it's all about, are these new people going to like me? Am I going to be accepted? What am I going to be able to do? So all of that leads to wanting to belong. So that comes the substance abuse. If there is an underlying mental illness, most mental illnesses are triggered by a traumatic event. So this adjustment could be just that, being isolated or not feeling that you could fit in could bring you to a point of depression, anxiety, and then all of that just wraps up together. It's almost like a perfect storm.
And how does a parent know? Like, how would I identify that? I mean, not thinking that Erica or my daughter was just going through the normal stages of nervousness, starting school, but how is a parent supposed to prepare or know that their child's suffering?
So you have to be involved is the bottom line. You have to be paying attention to all the cues. Oftentimes we get so mired down in our day-to-day activities and everything that's going on in our lives. And when we have a teenager that can get up and get dressed and do everything on their own, we're like, okay, they're good. We don't have to do anything. But you have to pay attention to the social cues. So isolating, not having conversations, you see that they're not really involved in activities, whether it's in school or anything like that. And then just having conversations. And that was in the piece that I sent to you guys. It's ever important to have those conversations. I was telling somebody today, actually, that at this age, if you're a pain in the butt as a parent, and if your kids don't like you, and if you're annoying, A+, you're doing a great job because you're there all the time. You're involved in all, oh, mom, you're so annoying. But you know what? You're also that parent that when something's going on, they're going to come to you and say, I'm not feeling well, but you're going to be able to notice the difference. Mm-hmm. So that's part of it, being involved. And go ahead.
That's a great point. I think it's harder in what parents do. Sometimes we live such a busy lives that sometimes we sort of push aside. Oh, they're just being okay. They're okay. But being a pain in the butt, like you say, it is something that is so important to do. I can tell you personally, this is something I tell my daughter. If I didn't care, I would not be so persistent. I would not make sure that I am on top of everything that is in your life, because I am driving your life. And the easy way out is really to say, whatever.
Okay, yeah, whatever. You're on your own. You're an adult. But they're not. And that's just it. They're in between.
Beyond noticing. Yeah, beyond noticing, then the next question is, okay, so I know something's happening. Now, what do I do? Yeah. So some of the things, okay, and I was able to get you on my big screen. So,
we're good. Can you hear us now? You might have mute your phone.
Muted or froze or whatever.
So, we definitely want to be able to get from her, like, what are the choices that the parents have? What are the ways that we can get
without medicating,
medicating, and what are the help that the ways that they can go into the social workers at the schools, right?
So, Erica's partner Kayla is a certified social worker, and she works in the schools, and all the schools, I would say, I can't say, quote, all the schools, but most of the schools have social work services. Right. So the kids can go to them when they can't, or they feel they can't go to the parents. Yeah. That's a big thing too. I was afraid when I was growing up with my dad. My dad was very strict. So to tell him that you're going through something, or you had too many drinks, you had too many, you can't do that. Yeah. You didn't do that back then. But today, I think we're making it much more open for our kids to be.
So, Lissette, I think we got you back. I know we lost you for a little bit, so go ahead, sweetheart.
Yeah, so some of the things that, so the school is your partner. One of the things that the parents can do is this week, go to the school, have conversations with the school and say, what are the things that you are offering to transition? So, for example, in my community, my daughter is actually entering 9th grade. So I am a parent who's going to be experiencing this. The school is offering a mentorship program. So they're pairing up 9th graders with seniors that are in the National Honor Society. and they're their mentor. So they're there for questions, issues, and anything that they may need outside of their regular social circle. So it's someone that they're going to meet. And so they sent a little survey asking about the individual's interests, and they'll pair you up with a senior who shares the same interests, and that will be your mentor, your guide for the first year to help with that difficult transition.
Is that new?
Aside from that, go ahead.
Is that new? A new program?
Is that?
I never heard of that before. That's a new program.
No, so it's not necessarily a new program, but it's new in my school district this year. This is the first time they're offering it. But you can check in your school district, and if it's not offered, then ask for it. Speak to the PTA and say, hey, listen, the statistics are staggering. What is the school district offering in order to help these kids transition? So this is the first year that my school district is offering that for entering ninth graders. Awesome. Beyond that, it's about exercising, setting a schedule, working, now this week is very important. So no longer this late night, 3 o'clock in the morning TV and all these shows, getting involved in the community, in activities, asking your children, what are you involved? And if you ask my daughter, she's not interested in anything. Right. And so, but the conversation, that's what, oh, mom, I'm not interested in anything. But the conversation didn't start there. And 3 hours later and 5 days later, we got to one little thing that she's interested, but I'm taking that and I'm running with it, because laying around stagnant and not being involved is not an option. And those are some of the things that you can do to prevent. There's still, unfortunately, a lot of stigma around mental illness. And it's about normalizing it. It's about having the discussion with the child or, at the dinner table and saying, do you want to talk to somebody other than me? Do you want to speak to a professional? There's nothing wrong with that. Of course, I'm biased being a psychotherapist, but there really is nothing wrong with that. And it's about normalizing. It's not about, shh, don't tell anybody that you're seeing a therapist, because that lends to, oh, there's something wrong with me. And there really isn't. You're someone like everybody else who needs someone to speak to that can relate and help guide you. And those are just some of the things, eating healthy, sometimes, a pill is not necessarily always the answer. Exercise, eating healthy, being involved in different activities, things of that nature can be a tremendous amount of help for a teen who's transitioning and experiencing difficulties.
I think you mentioned exercise, and I'm a very big believer of meditation, so I'm going to bring that back.
She does. Thank you for
so every conversation whenever I get a chance, I want to bring up meditation, because this is something that I'm actually teaching my daughter, and she's 10 years old. Before we go to sleep, we meditate for 10 minutes. And what I find is interesting, because when she's done, when we're done meditation, she gives me I needed that. The calm. And that's a 10-year-old that I am trying to figure out at an early age what tools that I know work for me, what tools can I incorporate and teach her at an early age. So what do you think of meditation?
I think meditation is tremendous. It lessens anxiety. It helps you, when you look at mindfulness therapy and mindfulness exercises, that helps zone you in. It really just helps bring you to the center, allows you to be with yourself. And I think it's very important. In line with that, I have a 14-year-old. So one of the things I've been working on with her is yoga. Let's get out there and let's do something. So it just like you with meditation, it helped with the bond, creating that avenue where it's just her and I, and you're doing something that is good for the mind, good for the soul, and good for the body.
Yeah. Lissette, I know that, you work with us. We're very lucky to have somebody like you, really, that cares for the community and want to make a difference. And you're our psychotherapist, and you are also helping us with the program where we are trying to do everything we can to bring mental health to the community. Because even though we're talking about this and there's such a need, But even though there's such a need, it is not accessible to most people.
Right.
And this is something that, you know, for us, I know this is our passion to be able to bring mental health to the community. But I couldn't believe when you could not give us enough hours, right? And we had a waiting list, and then we go to an organization that is supposed to be there for the community, and all they do is mental health. But there was a 3 months wait for an appointment. I mean, how crazy is that? What's your comment on this?
So that is unfortunately the truth. Can you see me there? I don't know what happened.
Yep, we can see you, we can hear you.
Okay, so that is very unfortunate, and especially when you're looking at bilingual services, they don't exist in the community. And what we find often is that medical problems, medical conditions sometimes mask the overall mental health condition. And you have to look at it from a holistic approach. And the numbers are staggering. There aren't enough services for the community members, and that's why I was so eager to work with you guys and continuing to build the practice, because the need is there. There are, unfortunately, in the Hispanic culture, not many people believe in therapy, or again, they think that if you go to therapy, it's because you're crazy. But what you find is once one person starts coming, they start recommending and say, I feel better, I feel this, and the word gets passed along. So as long as we can keep the word moving along, that it's okay to see a therapist and be involved, and that sometimes, not sometimes, all the time, the medical is connected to the mental health, and all of it has to be looked at as a whole.
Well, did you say that your brain, it's in your brain, and you can actually heal yourself with your mind, and it's the same thing when you think about mental health. And the other thing is that mental health isn't just the severe. It's like, someone getting your heart broken. You may need to talk to somebody about trying to recoup and get yourself over it, so it doesn't turn into where you feel sick and all of a sudden your body starts to hurt. And, it really does affect everything.
Right. I always say, it's getting somebody else's opinion, an expert that, like yourself, Lissette, you listen to many stories, you listen to many issues that people have, and you can guide them because you are somebody with an objective opinion there to help them and help them figure out how to get better, how to feel better. And what I find is that, I was thinking, because I talk to a lot of professional people, and ironically, so many people get therapy.
Yeah, I did for years.
And I think that, unfortunately, the lower, the people that are the blue collar workers, the people that, are the underserved, many of them don't believe, because they have the stigma that, that you're crazy if you're going to get therapy. But at the same time, they don't even think that how important it is, and that maybe they'll put aside something in their budget to be able to budget to take care of their minds. And it's something that we really have to make an effort to make a difference. You mentioned on the information you gave us, it says ending the silence in school, which I was very happy to read this information, because it talks about what you were saying. We need to bring it out, that it is okay.
Yeah.
It is okay if you have anxiety. It is okay if you're depressed. You need to just deal with it, and you need to concentrate on what is going to make you better, what is going to make you feel better. Because a healthy mind, like you were saying, is a healthy body.
And it's a snowball effect, right, Lissette? I mean, one thing.
It is a snowball effect. If the mental health symptoms left untreated can be very severe. You can go from what someone might say a simple depression and end up with a psychotic disorder if left untreated. And obviously, unfortunately, there is suicide. There are high incidences of suicide, especially among our youth, and it's important. And so one of the next questions that people ask is, where do I find a therapist? How do I even begin? The article that I sent you was an article posted by NAMI, the National Association of Mental Illness, and they're an awesome resource. And they provide a lot of resources for parents and for community members in general on how to, how to care for someone who has a mental illness, which is equally as important. If you're a caretaker, it's very, very important to understand, just like if it was addiction or somebody with asthma or somebody with cancer, whatever, if you're caring for someone with any type of ailment, it is incumbent upon you to understand, how do I administer the insulin? How many pumps does my child or my neighbor need? How many pills? What do these pills do? So that's also very important. And it can be very exhausting on the caretaker. So let's not forget the caretaker, because they also need care and support. NAMI is a wonderful resource. In addition, I also want to make sure that people understand that finding a therapist is about finding a good fit. Not every therapist matches with every individual. So if you're an individual seeking a therapist, you are also interviewing a therapist. There are different modalities of practice, whether it's dialectical behavioral therapy, whether it's cognitive behavioral therapy, and a whole bunch of other three letters that you may not know what they are. But much like if you go to the doctor and get some medication and you look at the side effects and you look at that, look at what those three letters mean. Make a phone call, and don't be ashamed to say, hey, so-and-so, I see here that you practice this type of therapy. Explain to me what that is exactly. Schedule an interview and say, hey, listen, I would like to meet with you. I'm not certain that you're the one, but I saw and I read your profile. I'm interested. Let's have a conversation. And that's how it should start. You're not obligated to see any one therapist. It's about finding a good fit, because it's about being able to connect. If you don't feel comfortable with that individual, if there's an age gap, or they, if you're not religious and they follow a religious modality and that's not you, and you're not going to be able to communicate effectively and get your emotions out there, you're not going to feel safe, and it's not going to work. So that piece is also very important.
Yeah. So we're going to try to add the link on the post that we're going to later do on this Facebook Live. But we also offer mental health services at Forme.
Very affordable. Very affordable.
Extremely affordable, because we are about the community and how do we bring these services to our community, especially mental health. That is something that is desperately needed. And I have to say that, I've said it before in some of the shows that we've done, that I've gotten help with therapy for so many years of my life, and I've been very blessed that I've been able to afford to do it, and that I have the mindset that for me, getting my mind healthy was a priority. And I know that you have done it yourself.
Oh, yeah, for years and years and years, going through the divorce and trying to deal with my daughter, who was a difficult child when she was younger.
But she's great now.
Oh, she's perfect.
She put all the energy in making
But Maria, I want to just capitalize on something that you just said. You made a very, very valid point. Getting your mind healthy. Your brain is the most powerful organ that exists in your body. Sorry, gentlemen, if you thought it was something else. But the brain, because everything that happens in your world, in your life, in your body is governed by your brain, if you will, for lack of a better word. And if your brain isn't healthy, then the rest of you cannot possibly be healthy. And also vice versa. If your body isn't healthy, if you're not taking care of yourself in terms of what you ingest and how you exercise and all of that, then your brain can't be healthy. So again, the mind-body connection is extremely important.
Yes. We need to continue to promote this. We need to continue, like you said, to be open about, like us talking about the fact that your daughter got help. I can tell you were talking about the interview, and I remember about 4 years ago, I needed to get help for my daughter. I needed guidance on how to deal with the situation. And I started calling different therapists, and I started calling the the pediatrician, and I said, can you refer me to a few therapists that will take care of kids her age? And she's a young girl. I mean, she was then like 6, 7 years old. And when I called and interviewed the therapist, as you mentioned, I realized the ones that were not a fit almost immediately. And I remember talking to a therapist, and this person said to me that, well, I think you need to talk to a psychiatrist. And I said, you haven't even met my daughter, so how could you say that? And
like medicated.
It's, you know, some people go the easy route, I guess, but even the fact that she never met her and she was making an assessment just based on a conversation, to me, I knew that wasn't the right person. And I have to say, I ended up finding somebody amazing that specialized in what my daughter needed. And after 2 years of seeing her, my daughter is great. But I put the energy in making sure that her life, I took her life in my hands, like Gina did for her daughter, and we took action. So for those parents out there that are listening, please take a look at what's going on with your children and realize that you need to do everything you can to find the help. And the help is out there. You could always call us. Yes. We're here to help you. And unfortunately, it's 30 minutes. We already, it went so
Oh my
fast.
God, I have so much more to say. Really quickly, therapy cannot be forced. So it's a conversation. It's working with your child and saying, hey, I think this would be a good idea, and easing into it, because it has to be an agreed upon act. But that's it. 30 minutes is not enough.
Thank you so much for helping us in giving such a valuable information. We really appreciate it. And thanks to everyone that has tuned in and are following us on Facebook. Thank you so much. We really appreciate it.
And we'll see you next Monday.
Yes, actually next Monday we are taking off because it's Labor Day.
Oh,
it's Labor Day.
Yes, but we will be on the 10th, and we're going to have a show that is going to be amazing. We're going to be talking about sex and menopause. So stay tuned.
Stay tuned. See you then.
Bye-bye.
Bye. Thank you.
Thank you.